Person-centered care, as opposed to patient-centered care, which reduces the patient down to their symptoms and disease, delves deeper into creating a healthcare environment where the person receiving care is regarded as the expert in their own health. Person-centered processes incorporates the patient's individual preferences, beliefs, and values in their care. Person-centered processes are actions that nurses can initiate to ensure that person-centered outcomes are being achieved. These patient outcomes include a good care experience, involvement in care, feeling of well-being, all of which aid the existence of a healthful culture. This video will focus on person-centered processes of providing holistic care, being sympathetically present, sharing decision-making, engaging authentically, and working with patients' beliefs and values in order to achieve person-centered outcomes. Holistic care is utilized through using comprehensive, person-centered processes that embody physical, psychological, cultural, social, and spiritual well-being within the management of the patient's care plan. It is the umbrella that holds all aspects of person-centered care under. Working with the patient's beliefs and values promotes person-centered outcomes as the patient feels like their life experience, beliefs, and values are being respected. Working with the patient's beliefs and values in care also creates an environment of cultural safety. Enacting care that works with the patient's beliefs and values allows the patient to feel like they're involved in care, promotes feelings of well-being, thus promoting a good healthcare culture. Working with the person's beliefs and values can be exemplified by using nonverbal cues such as eye contact, proximity, therapeutic touch to establish rapport and trust to share information. Actively listening to patients to collect information about beliefs and values. Asking if they're uncomfortable with any aspect of care or if care is culturally inappropriate. Explaining information regarding their condition to enable them to feel informed decisions about their health and treatment routine and how it may impact on their daily life. By acknowledging the patient as the expert in their own health and as a part of the healthcare team, in conjunction with understanding the patients within their own idiosyncratic context, responding empathetically and providing supportive care in terms of building partnership with patients, promote self-determination in health and positive person-centered health outcomes. Engaging authentically with patients demonstrates genuine interest from the healthcare provider in the patient's health. This establishes rapport, trust, and builds a good therapeutic relationship, which in effect creates a good healthcare experience and feelings of well-being. Authentic engagement can be evidenced as a genuine regard for self and others, demonstrated through a mutual caring for the well-being of patients, through recognition of the responsibility to uphold individual rights, including the right to respect, dignity, full engagement in life, and self-determination. Commitment to valuing others and feeling valued, where both parties feel like they're an integral part of the process and partnership and are not being judged. Honoring individual uniqueness, and believing in the potential of all humans for growth and development. Understanding the synergistic relationships in healthcare by recognizing the interconnectedness and interdependence of everyone in the community, including the diversity of stakeholders, where all voices are valued for better patient outcomes. Establishing rapport, actively listening, paraphrasing, and using reflective answers, maintaining open body language and eye contact also demonstrate authentic engagement with patients. Shared decision-making puts the power into the patient's hands and fosters self-determination and person-centered care process outcomes, in conjunction with the patient's preferences and respects their autonomy. This creates a healthcare environment that is culturally safe, person-centered, and relies on patient education, which enables a good care experience as patients have an understanding and knowledge about their health and involves the patient directly with care. This, in effect, establishes a feeling of well-being as the patient's health progresses. By educating the patient through the use of brochures, answering questions, or elaborating on health problems using understandable language and not nurse jargon, additionally educating patients on their rights in hospital, enables the patient to be able to make well-informed decisions about their health and allows the multidisciplinary team and patient to work in conjunction together to achieve the best health care outcome for the individual. Being sympathetically present requires the nurse to identify and acknowledge a patient's feelings in order to build a positive patient-healthcare provider relationship. By definition, sympathy can be taken as expressing pity towards the misfortune of another, especially someone who has suffered unfairly. In contrast, empathy can be defined as an ability to understand and accurately acknowledge the feelings of another, leading to an attuned response from the observer. People are more responsive to empathy than to sympathy. Empathy elicits an effective response that acknowledges and attempts to understand an individual's suffering through emotional resonance. In the healthcare setting, true caring involves astute observation, accurate assessment, focused listening, and responsive, reflective questioning. When care is carried out this way, in conjunction with all the other person-centered care processes stated, optimum person-centered care can be provided. Being friendly and approachable is essential during the initial stages of building a trustworthy patient-healthcare provider relationship. Healthcare professionals should possess the ability to read cues in a patient's word choices, posture, actions, and gestures. Tuning into these from a place of genuine attention in a non-threatening, open-hearted, and empathetic way gives a clear message that we care. It is not only important to consider the patient's feelings, but also those that care for them, involving both patient and their family in the care by giving them the power to comment on their care and empowering them to actively participate in interactions leads to the reinforcement of positive experiences in healthcare. Leadership challenges. A study completed by Bolster D and Manius E in 2010 revealed that in acute care environments, person-centered care was often neglected in regards to medication activities due to time pressures that nurses felt. Interactions were centered on routines and the nurse's perception of what is important for the patient and would neglect patient-centered care practice. Therefore, didn't provide opportunities for patient participation or education on the medication being administered. Additionally, professionals working according to traditional care pathways can restrict the freedom to work flexibly and use different strategies for person-centered care. The physical structure of wards have proved an obstacle for developing a partnership with patients. For example, 4-bed bays in wards lack personal space for listening to sensitive issues in hospitals, where a lack of private rooms affect communication between professionals and patients. This structure of the ward may not be person-centered architecture at all. Additionally, nurses' attitudes can also be a barrier to person-centered care. With burnout and fatigue common in the nursing population, it can be easy to slip into task-orientated care. Maintaining a person-centered care approach requires a conscious effort. Partnership between the patient and the healthcare practitioners is effective negatively when professionals do not see the person in the bed. Attempting to change task-orientated habits requires continuous attention and engagement with person-centered care processes. Practice innovation. Redland Hospital's training exercises in collaboration with Metro South's Plaintree program that is being integrated into all Metro South hospitals is a great real-life example of practice innovation to tackle issues of nurses losing sight of compassion in the care that they were delivering. Redland Hospital gave staff an opportunity to feel some of the challenges their patients face on a daily basis as a part of their new person-centered care experiential workshops, giving nurses an opportunity to refocus on the patient in person-centered care. These workshops set tasks for nursing staff that emphasize the importance of delivering care with empathy and compassion. Additionally, staff members participated in activities where some staff used equipment that limited manual dexterity and the ability to see and speak, while other staff members acted as nurses, utilizing person-centered care approaches, and others not. By role modeling the differences of care delivery, it increased staff self-awareness of the patient's feelings, as staff who were treated using person-centered actions felt satisfied with their care, while staff who weren't were not satisfied. These training exercises gave nurses a great reminder of what the challenges their patients encounter on a daily basis and allowed nurses to re-establish empathetic and compassionate practice. Clinical nurse consultant of quality medicine and emergency, Damien Dwyer, stated, "It is about how the patient sees the world. To take time to stop and think about the person in front of you, to get to know patients along the way and pass on the needs of the patient to other staff." In conclusion, as nurses, we are just humans looking after other humans. It is necessary that we treat our patients as the idiosyncratic individual who has their own beliefs and autonomous thought. We need to remember that at the core of it, as nurses, it is our job to care and understand that these people in the beds are not just tasks to check off.